Dr. Spiro, thank you so much for joining me for another Q&A to talk about COVID-19 testing and this pandemic as we turn the corner into winter.
Good to see you, Thomas.
And what kind of testing are you seeing at organizations that are at a higher risk for an outbreak?
The most successful testing regimen is surveillance testing. So you're not just doing asymptomatic testing when they come back to work. You continue to do asymptomatic testing on a regular basis. And what I've seen from studies, like a simulation study that just came out of Harvard School of Public Health and the University of Colorado, is that when you're doing, the more frequent you do testing, the lower you can reduce the transmission rate, or that R or R naught. Where I saw like the peak where you really start to get the most benefit is when you're doing surveillance testing at least once a week. Twice a week is a lot better than once a week. Once you go beyond twice a week, if you go to daily, you do get an improvement from twice a week, but not as much. It's just an incremental improvement. So every 3 days is probably a really good number to be doing surveillance testing at.
And one of those organizations or those industries is the film industry, and in-house physicians is now at the movies. How is that going with the film production?
Yeah, so we're heavily involved in productions. I think we're over a dozen productions now in North America, both in the United States and in Canada. And those folks are broken up into zones. That's another strategy. So the folks that can't perform social distancing, can't wear masks, are doing kissing scenes and that kind of thing, they get tested more frequently than the crew that's behind the scenes that is social distancing and that is wearing masks all the time. So you have different surveillance frequencies for different folks. So the folks that are close contact 5 days a week and that sort of thing, not wearing masks, they get tested up to every day. So we have some film productions that are testing 7 days a week. Now, if you're testing 7 days a week, you better be using rapid testing, because otherwise it kind of loses its benefit if you have to wait a couple days to get the results back. So rapid testing is very common. And so you're seeing frequencies of between once a week and 7 days a week of testing.
Now, you say rapid testing, do you mean antigen testing?
In the film industry and in many other industries, antigen testing still isn't thought of as being very accurate. And that's true. It's not as sensitive because you're not amplifying the nucleic acids like you would with molecular testing, where you're amplifying the amount of genetic material 1,000 times. So obviously you're going to be more sensitive. So with rapid testing, you're looking at molecular testing, and with molecular testing, you're looking at PCR or like the Abbott ID Now testing. Unfortunately, most PCR testing still, the best you can get is like 24 hours or a little less than 24 hours. We work with a couple labs that are in different local areas like LA and New York, where we can get results back in 8 to 12 hours for PCR testing. But the Abbott ID Now, you can get it back in 15 minutes. But there are other industries where people are using antigen testing and they understand it's not as accurate or as sensitive. And if you're going to use that type of inferior testing, then you're going to have to do frequent testing. I mean, like, surveillance testing where you're doing it at least a couple times a week for it to really be effective for you.
And one of the other industries that we're in now is the aviation industry. Can you talk about what we're doing there with the pilots and testing?
Yeah, so, well, that's more of a function of the requirements of getting into certain countries. So we're working with air cargo companies and airlines where their staff and crew have to get tested to enter a different country. And they can either get PCR testing, and now in a lot of those countries, they can get Abbott ID Now testing done. And we're testing them before they hop on a plane. So they may have a layover in Anchorage and they're on their way to Hong Kong or Shanghai, and they can't go there unless they get tested first. So we're doing that testing for them right at the airport.
Now, this is the question that I posed to you in the summertime, and I'm going to ask you again. Are we going to start to see some lag with the labs as we approach the winter?
Absolutely. I mean, just supply and demand. The demand's going to go up significantly. It already has with the Abbott ID Now. There's a severe shortage with that testing. And with PCR testing, even though we have more labs doing PCR testing, because of the demand, you're going to see lag times that could go into several days. And I don't have a crystal ball, but I wouldn't be surprised if some of the big national labs like LabCorp and Quest start getting longer than that as far as turnaround times.
Do you think it's better to make a decision now rather than later to beat the lag times that's going to happen with the labs?
I can't really tell them about the timing of when they want this based on their own internal requirements of getting employees back to work, and whether it's large employers or whether it's universities. But what I can say is if you need to have your employees back at work, or if you need to have your students back at school, and it's a decision between not bringing them back to work and losing a lot of money or doing testing, I would highly recommend you consider doing surveillance testing and put that into your budget. That's what I'm talking to a lot of employers about is you have to go to senior management and show that, hey, if you put this into your budget, if you spend $500,000 or $1 million or more, a couple $1 million to do surveillance testing, you can get that R transmission rate, that R naught, down to close to well below 1. So you're not going to have outbreaks. You're going to have much less of a chance of having outbreaks. And that will ensure business continuity and keep the revenue flowing. So you got to put it into your budget now. I don't know when you're going to start it. It's based on your own, the organization's own business objectives, but you put that budget in now, it will pay off in dividends in the future. Think of about a university that still has their students in the winter studying remotely. They're going to be dropping out from your enrollment and going to community colleges or other less expensive options. They're not going to be using your housing. So you just have to put that into your budget, because you could be losing tens of millions of dollars where now you actually have a solution that works. So don't wait, and start working with your senior leadership to put it into your budget.
Dr. Spiro, thank you so much. This has been insightful and informative as always. I really appreciate your time. Thank you.
Hey, thanks, Thomas. Great talking to you.